almost 60% of our babies had a zone 2 ROP, whereas 40% had AP-ROP. The results, the treatment success we defined as a complete regression of retinopathy and vascularization in zone 3. Primary treatment success was defined where the outcome was achieved only with a single intravitreal injection. We observed it as 75% in our series. The secondary treatment success when additional laser ablation was done, which was 25% in our series. We observed no major complications. The indication for retreatment are poorly defined. Recurrence of neovascularization or any plus disease seems to be a uniform indication for retreatment. In our series, retreatment was done at the mean age of 44 weeks, which was corresponding to the 7.8 weeks post-injection. In another study, the retreatment window was much earlier, as like 51 weeks, which was corresponding to the 16 weeks. Coming to the rainbow trial, we had a similar outcome, like 80% of the infant achieved the same primary outcome. Coming to the conclusion, we found ranibizumab achieved a stable retinal vascularization with low rate of complication as well as fewer recurrences. It achieved similar anatomical outcome as bevacizumab without additional risk of major complication and systemic side effects. Coming to the limitation, our population was limited to the Asian patients in a tertiary eye setting, and we did not perform FFA. Here, as we can see, the ROP was resolved with a single IVR injection at 10 months follow-up, whereas the secondary outcome can be seen in second picture where the laser ablation was done. Thank you.
Thank you. That was a good presentation.
Good presentation. What was the what is the advantage of intravitreal over laser?
We allow the blood vessels to grow into zone 3, where ablation we have to do it either in a zone 2 or then ablation destroys the retina. So the field of vision and other complications are much less as compared to the laser ablation. We allow the babies and the blood vessels to grow in the zone 3. That is the advantage. And single therapy less traumatic to the patient, babies, family, everything.
Thank you.
Thank you so much.